There is new evidence tonight suggesting the Omicron variant was here in the U.S. before the world knew it existed. Days before it was announced it had been found in South Africa. And now new signs tonight that the Omicron surge is slowing across parts of the country, the east, where it was the epicenter at the beginning, and what they're seeing now. But authorities say hospitalizations still at a record high, and deaths, which always lag behind new case numbers, still at about 1,700 deaths a day. Nearly all of the deaths, health officials say, among those patients who are unvaccinated. Here's ABC's Stephanie Ramos on how long Omicron has been here and how they figured this out.
Tonight, new evidence suggests Omicron was in this country before the world learned of the new variant. A CDC study found traces of Omicron in New York City wastewater on November 21st, 4 days before the variant was announced by South African scientists and 10 days before the first U.S. case was reported.
By sampling in wastewater, you can detect virus in huge populations. If we can identify a variant faster, we can respond more quickly and make sure that we reduce transmission in the community.
Infections in New York City have dropped 46% in the last week, but the city still has the nation's highest death rate because deaths and hospitalizations always lag behind cases.
I do think we are past the peak of the Omicron surge, but just because we're past the peak does not mean we're done. We have several weeks to go before the infection numbers really get low.
1,700 Americans with COVID are still dying every day, the vast majority unvaccinated, like Angeline Saucedo, a 34-year-old mother of 4 in Oklahoma. Her mother says Angeline didn't know she had diabetes when she was hospitalized with COVID.
By day 3 of going to the ER for 3 days, my daughter was gone.
The family had put off getting the vaccine, but Angeline's death has pushed them to get the shot.
You're scared to get vaccinated, so am I. You know, I still haven't got vaccinated, but just that happening actually makes me want to do it.
Tonight, New Jersey's governor is warning healthcare workers they could lose their jobs if they are not vaccinated and boosted.
We are no longer going to look past those who continue to put their colleagues and perhaps, I think even more importantly, those who are their responsibility in danger of COVID. That has to stop.
Across this country, hospitals are struggling to care for 160,000 people with COVID. Nurses inside this Pennsylvania hospital say they are drowning in patients.
We're seeing 20, 30, 40-year-olds that are ending up very sick and dying, and they don't have the conditions that some of these older people have.
Stephanie with us now tonight, and there's new research at this hour looking at, patients who were given the vaccine, those who thought they were getting the vaccine, and those who actually got a placebo instead. And this was meant to study potential side effects.
Exactly, David. So researchers looked at 12 vaccine safety trials with thousands of people and found that 2/3 of volunteers who got the placebo reported things like a headache and fatigue, suggesting that those relatively mild side effects widely reported from the COVID vaccine might not be as common as people may expect. David.
Stephanie Ramos with us tonight. Stephanie, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.